Thrombocytosis is a medical condition characterized by an unusually high number of platelets in the blood. Platelets are a type of blood cell that helps in blood clotting to stop bleeding. Thrombocytosis can be divided into two types: primary thrombocytosis, also known as essential thrombocytosis, and secondary thrombocytosis, which is a reaction to another underlying medical condition. Causes of thrombocytosis. 1. Primary thrombocytosis. Essential thrombocytosis is caused by an abnormality in the bone marrow, leading to the overproduction of platelets. This can be due to mutations in genes like JAK2, CALR, or MPL, which regulate the production of blood cells. Primary thrombocytosis is a rare condition, affecting about 1 to 2 people per 100,000. 2. Secondary thrombocytosis. Secondary thrombocytosis is more common and is usually a response to another underlying condition, such as iron deficiency anemia, bleeding, infection, inflammation, cancer, or splenectomy removal of the spleen. In these cases, the body produces more platelets as a reactive mechanism to these underlying conditions. Diagnosis of thrombocytosis. Thrombocytosis is typically diagnosed through a blood test called a complete blood count (CBC), which measures the number of platelets in the blood. The normal platelet count ranges from 150,000 to 400,000 per microliter of blood. Additional tests may be done to determine the underlying cause of thrombocytosis, such as a bone marrow biopsy or genetic testing. It is essential to identify the cause of thrombocytosis to determine the appropriate treatment plan. Treatment options for thrombocytosis. 1. Primary thrombocytosis. Treatment for primary thrombocytosis aims to reduce the risk of blood clots and manage symptoms. This may include medications such as aspirin to prevent clots, hydroxyurea to reduce platelet production, or interferon therapy. In very advanced cases, procedures like platelet apheresis or bone marrow transplant may be considered. 2. Secondary thrombocytosis. Treatment for secondary thrombocytosis focuses on addressing the underlying medical condition. This may involve treating iron deficiency, infections or inflammation, adjusting medications, or managing cancer through chemotherapy or radiation therapy. In some cases, anticoagulant medications may be prescribed to prevent blood clots. In conclusion, thrombocytosis is a complex medical condition that requires proper diagnosis and treatment. By understanding the causes, diagnosis, and treatment options available for thrombocytosis, patients can work with their healthcare providers to effectively manage the condition and improve their quality of life.